In the face of the growing epidemic of opioid misuse, addiction, and overdose, how can we ensure that patients and residents in post-acute and long-term care have access to the full range of available pain management tools? Hi, I'm Chris Laxton, Executive Director of AMDA, the Society for Post-Acute and Long-Term Care Medicine. Opioids can be a very important component of effective pain management for patients in Paltc settings, but we need to ensure that they're used strategically and thoughtfully. According to the Centers for Disease Control and Prevention, opioid overdoses killed more than 47,000 people in 2017. But CDC also notes that opioids can be helpful for treating pain when they are used appropriately. A recent report from the Federal Interagency Task Force on Pain Management Best Practices recognizes the unique needs and risk factors of older adults requiring pain management. Sadly, the report fails to acknowledge the resources AMDA has developed over years, specifically to provide education and clinical guidance on pain management in this vulnerable population, stating that there is a lack of opioid prescribing guidelines for older adults. In fact, the Society has a comprehensive pain management guideline, offers education to clinicians on pain management in Paltc, and recently developed a new statement of policies and principles for opioid use in nursing homes. AMDA's new policy statement has two elements. The first calls for providing access to opioids when indicated to relieve suffering and to improve and maintain function. The second promotes opioid tapering, discontinuation, and the avoidance of opioids altogether when those goals aren't achievable in order to prevent adverse events, dependence, and diversion. And the statement also outlines some important opioid stewardship principles. These are, first, that practitioners prescribing opioids must do so based on a thoughtful, interprofessional assessment that provides a clear indication for opioid use, inadequate response both to non-pharmacologic treatments and to appropriate non-opioid pharmacologic treatments, and a patient's condition that justifies the risks and benefits of continued opioid use. Second, that practitioners managing patients who have been prescribed opioids must minimize the risk of adverse events, dependency, and diversion by never prescribing long-acting opioids for opioid-naive patients, tapering opioids to the lowest dose necessary to maximize functional ability, tapering and stopping opioids when the risk outweighs the benefit, and prescribing opioids at the time of discharge in only the minimal amount necessary to transition the patient to a follow-up appointment. Third, that medical directors, as part of the interprofessional team, are responsible for overseeing care policies and processes that guide appropriate prescribing and use of opioids, participating in efforts to prevent opioid diversion, and providing ongoing education related to opioid prescribing, safety, and monitoring. Finally, the Society advocates for more consistency in legislation, regulations, and other public policy across states with respect to special needs of the Paltc resident and patient population. State and federal policy must promote access to substance use disorder specialists and must reduce barriers to obtaining medications used to treat opioid dependencies. Laws that arbitrarily prevent appropriate, needed access to opioids for symptom relief are unacceptable. Our upcoming annual conference in Atlanta this March will feature a Meet the Expert breakfast titled On Maintaining Respect and Dignity, Addiction Medicine in Paltc, which will focus on some of these issues. Go to the conference website, shown on the screen below, to learn more. You can also listen to our AMDA On The Go podcast episode on the subject of opioids and pain management in Paltc. With your help, we can ensure that Paltc patients and residents receive the highest quality, compassionate care for optimum health, function, and quality of life. Thank you.